There are thousands of scholarly peer-reviewed journals you may use in your research. The articles in these journals are written by professionals for professionals. Yes, that's you. These are not publications that are read by the general population. These journals contain the knowledge of experts for consumption by other experts. They are highly respected journals and go through a peer review process. Scholarly peer-reviewed journals contain many types of articles. Editorials and letters to the editor discuss current and sometimes controversial topics of the profession. Position papers, current practice guidelines, evidence-based practice guidelines, and best practices documents give the current collective thinking of the profession. Historical articles and reflective essays discuss the dilemmas, the constantly increasing knowledge base, and the growth of the profession. Here is an editorial from the American Journal of Speech-Language Pathology. As we look at the end of the editorial, we will see that in professional journals, even opinions given in editorials and letters to the editor are backed up with research. Notice the list of references given here. Associations may publish their position papers in journals. Here is a position statement from the American Speech-Language Hearing Association concerning the role of SLPs with autistic clients. This is a current practice guideline for the diagnosis and treatment of dysphonia. And this is a reflective essay on the ethics of treating the deaf or hearing impaired population as a disabled population. You will find all of these types of articles and more in scholarly journals. However, the bulk of articles in scholarly peer-reviewed journals are something called research articles. You will be asked in your time here at UNC to find research articles related to a topic of your choice or a topic chosen for you. You need to understand what research articles are and how to quickly recognize research articles. The premise of a research article is very simple. A researcher, also known as an expert, has a hypothesis she wants to test. Now, generally speaking, a hypothesis takes a lot of time and work to test, so the researcher gathers together 1 or 2 or 3 or 20 more experts to work on the project with her. And then they simply test the hypothesis. The research article is a write-up of the research process. And, very nicely for us, the research process is a step-by-step process, and when it is written up to be published in a journal, it also follows a very specific format. After the title, you should find an abstract that is probably about a half a page long. It is a very brief summary of the research, and it is generally labeled with the word abstract. Here is an article from the International Journal of Pediatric Otorhinolaryngology, where the researchers were testing the hypothesis that hearing-impaired children are more likely to experience depression. After the abstract comes the introduction, which may or may not be labeled. This section may also be titled Objectives. Take note of the various numbers in brackets. This is one style of text citation. The authors of this article are referring readers to other sources that help support their research. This is called a literature review or lit review. Every good research project first starts with a review of the written knowledge in the field to determine if this hypothesis has already been tested, why it makes sense to test this hypothesis, and so on. A literature review may sometimes appear separate from the introduction, but most times you will find it as part of the introduction. After the introduction comes a section where researchers tell you how they set up their research experiment. This should be a step-by-step retelling of how they went about testing their hypothesis. If there are people or animals involved, the authors will give you information on the participants or subjects, how many there are, how many groups they were divided into, such as a control group and an experimental group, ages of the participants, health conditions, and more. In this section there will also be information on the procedures the researchers followed. For instance, if the participants were followed for a period of a year, if they were asked questions or if they were just observed, and so on. You may find this section has different names such as method, methods as you see here, methodology, design, design and procedure, and others. After the methodology section comes the results, data, or findings section. This section is often filled with lots of numbers and charts and graphs. The results section presents the actual and often numerical findings of the research experiment. Following the results comes the discussion. Sometimes the discussion is followed by a separate conclusion, but most often the discussion and conclusions are together in one section. In this section, the authors will explain whether or not they proved their hypothesis correct, and why or why not, and overall interpret the results of the research for the reader. Further, the authors will give the implications of the research, both on future research and on clinical practice. Finally, there is, of course, a bibliography or list of references. So here's my first question to you. If a research article includes a summary, introduction of the problem or hypothesis, a literature review, a step-by-step review of the design and procedures of the research, the data or findings, an interpretation of the data and the implications for the future, plus references to all relevant research by others, how long should a research article be? Obviously, a research write-up, a good research write-up, cannot be done in just a few pages. As a general rule, research articles will be at least 5 pages long and upwards of 50 pages long. So if you are looking for research articles, when you search, first look at the page length. Notice that article number 2 in this list is only a few pages long. This is probably not a research article, but the others are all 5 pages or longer, indicating they may very well be research articles. In determining whether an article is a research article or not, next read the abstract. Here we see what is called a structured abstract. Structured abstracts are actually split into sections, as you see here. This is another indication that this is a research article. However, some research articles do not have structured abstracts. You can generally tell when you read the abstract if the article is a research article or not, because if the abstract discusses participants or methodology, then it is a research article. Many types of articles have introductions, but only research articles have methodologies. So far, we have been talking about primary research articles, which are also known as original research articles. Primary research is one group of researchers testing a single hypothesis and writing a single research write-up. When you are researching, however, you will also find articles that look like research articles but are what are known as secondary research articles, and are sometimes called reviews, systematic reviews, or meta-analyses. These articles are one step away from primary research. Let's say that a researcher wants to know all of the research done on low-frequency repetitive transcranial magnetic stimulation to treat aphasia. That author looks and finds all articles on aphasia patients treated with low-frequency repetitive transcranial magnetic stimulation, and then writes an article for readers that summarizes and compares the finding of all the former research studies done. Because secondary or review articles are also research, they too will have a methodology. However, instead of discussing participants in the methodology, the number of studies, aka articles, will be discussed. Okay, you should now be able to recognize research articles in your sleep. Let me know if you have any questions. Please do not hesitate to ask.